It was December 2003. I'd been living in the New York City area for 14 months pursuing an acting career, something I'd always dreamed of. It was exciting. I'd been cast in 2 plays, networking, taking classes. I loved it. But as much as I loved it, I was so ready to escape the rat race and head to my hometown in southern Indiana to spend Christmas with my family. This would be the first Christmas in my parents' new home, and my father finally had the fireplace he'd always dreamed of. I envisioned sitting by a roaring fire, sipping cocoa or wine, and listening to Christmas music, watching Christmas movies, playing games, or just hanging out. 5 days before my departure, I visited my doctor. I had noticed some bruising over the past few months, and not having been prone to bruising, I just chalked it up to getting older. After all, I was 37. But it was getting harder to ignore because the bruises were appearing more frequently and they weren't going away. On December 18th, in a hospital room, I was told, "You have leukemia." I was hospitalized for 10 days, and my chemo began at 8 p.m. on Christmas Eve. Not the holiday I'd imagined. After that, I moved into my sister Barbara's home, where she and her husband Dan took over paying all my expenses. Multiple hospitalizations for high-dose chemotherapy would be required, and possibly a bone marrow transplant. At the time, I was unemployed. My savings was nearly depleted, and my COBRA coverage was set to expire in 2 months. So one of my major concerns was that I might not have health insurance after February. And even if I did, would my leukemia treatment be covered? Because cancer is a major pre-existing condition. So it was that Barbara and Dan's financial assistance was very necessary when my monthly premium tripled as I successfully transferred into the individual health insurance market. I ask you, do you know if your medical coverage is adequate? Should you be hit with an acute or chronic illness or medical emergency? Do you even have health care coverage? I tell people all the time, it is vital to have good health insurance. Find a way to pay for it, because in our system, if you don't have it, the consequences can be catastrophic. That first hospital stay cost $82,000. My insurance company picked up 15 grand. I paid 550. The hospital wrote off the remaining 66,000+. Based on the statements I actually saw and what I know to be the cost of bone marrow transplant, I estimate my treatment ranged from $750,000 to $1 million. It is frightening to receive a cancer diagnosis. It is just as frightening to think you might not be able to pay for coverage. Had I not had family who was not only willing to take me in and cover my expenses, but more importantly, financially able to do so, I wouldn't have had the medical coverage that allowed for the excellent level of care I received or the life-saving bone marrow transplant, which is a whole other story that you can read about in my book, Rebirth. My healthcare story has a happy ending. And one of the best parts of that story is that when I was diagnosed, my nephew Aiden was 1. I adored that child. It was agonizing to think I might not live to see him grow up and he would never know how much I loved him. He turns 12 on December 28th. He has 2 sisters, a brother, 2 cousins. I don't have children of my own, but they are my kids too. I feel so blessed. And it's because of these blessings and my cancer experience that part of the work I do is to help others maneuver through our complicated, confusing healthcare system, to work to make it more affordable and accessible so that anyone facing a medical emergency or devastating illness will at least have the chance for their happy ending too.